If you look back 3 years ago, is what we were doing with snake bites, and a lot of the emphasis was, bringing people into the hospital, giving them antivenom, but people were really being discharged without a place to turn to. And there were just a lot of questions that were coming forth, and to be frank, there's a lot of bad information on the internet. And so what we thought is what we would do is let's create a home for all snake bites in the state of Alabama. And that's really sort of what catalyzed for bringing this into existence. Our clinic is really fascinating because it's such a multidisciplinary approach. When someone comes into the hospital, if they're admitted at Children's of Alabama, they actually get taken care of by myself, who's a medical toxicologist, in conjunction with the hospitalists, the ER physicians. If you get admitted to other hospitals throughout the state of Alabama, those physicians are usually actually contacting us through the phone through the poison center. But what's great about our clinic is we recognize, hey, a lot of people are having persistent, wound problems, a lot of swollen arms, swollen legs, people are getting these blood blisters. So we really started collaborating with our colleagues, really our wound care specialist and sort of our burn specialist, with the idea of let's bring people that are used to seeing sort of a lot of swollen joints and swollen legs and have them work with us, and let's get together. And that's really what I think makes us so unique. Our immediate feedback has actually been overwhelming. To be frank, I think a lot of what we do is really just provide reassurance, and so people have a place to turn to when they ask questions. And we sit down and go over sort of expected healing, and how long that's going to take, and that way people aren't trying to Google and go through the internet and get all these sort of different recommendations. And I think because of that reassurance that we are able to provide, is the feedback both from our adult patients but also parents of patients here has been overwhelmingly positive. The best way is actually called the Alabama Poison Information Center. We have amazing poison center specialists there that actually review every single snakebite case, and then they're the ones that coordinate care both while someone's in the hospital, but then they also facilitate sort of recommendation and referral to our snakebite clinic. And if anyone wants to be seen in our clinic, usually it's actually the hospital that's contacting us. And so at discharge, most hospitals, we ask them if they want to have who's ever admitted follow up with us. But if anyone ever gets discharged or they change their mind, they can always just call the Alabama Poison Information Center. I'm just very appreciative of the approach that we've taken at Children's, which is, hey, let's bring all these different people together who have a wide range of specialties, and let's try to coordinate the best care for people. And so I'm lucky in that I get to talk to you about it, but there's so many people at Children's that have come together really to build this program that I'm exceptionally grateful for.